Hi everybody. It's about 3 degrees here in upstate New York, but I have my nice enclosed porch so I can get out here and get some sunshine, and my plants like it too. So welcome. Thanks for being here today. Today I'm going to talk about 3 reasonable expectations that someone who has DID, dissociative identity disorder, could have when they go to a therapist or embark on mental health therapy. And the first one I would identify is we want to help that person to stabilize. So it's very reasonable to think that by going to a therapist, I am going to feel more stable if I'm having some troublesome symptoms. And the biggies that, the dangerous ones would be feeling suicidal, feeling like you're going to self-harm, feeling like you're going to hurt somebody else. Obviously, those are very problematic. And you could expect that if we're going to start with therapy, that those things would be stabilized. And again, things are quite the continuum in life, and it's not all or nothing. And please remember, I'm just giving my experience here, some information. I'm not your therapist, unless I am, but we know each other. If you're in serious suicidal or homicidal dangerous zone, you need to go past a private mental health counselor like myself, and you really need some kind of psychiatric care. That hospitalization might be an option. And at least an assessment in an emergency place like that. All that being said, let's say you're not actively suicidal, but that part kind of comes and goes, and so do my experience working with people, whether they have DID or not. Kitty is gonna interrupt here. Is that suicidal parts can get active, and we could expect to help those parts feel less like that and activate less frequently. The same with the self-harming ones. My experience is there is usually a reason why those self-harming parts would be active, and we kind of go on this little journey together to help them to feel safe, or sometimes they're believing things that from the past, like they're on trauma time, and it's just not true for today. So the work with a therapist can help with the time orientation, and the main person to gain skills in regulating those parts a little bit more, or at least understanding situations that they might put themselves in inadvertently, even, that might activate some of those more self-harming parts. So working with a therapist can help identify what those situations might be and how to navigate, if you have to be in such a situation, how to mitigate the activation, or even how to set boundaries and not be in those situations at all. Number 2 that you could expect with therapy is help with, this is such a hot topic, but eating disorders. And there are places that will treat eating disorders, absolutely. And sometimes they are so severe they require medical care and hospitalization. However, if it's not something that, okay, I need to go to the hospital, what's interesting again with my experience is there are the different alters or personalities, they're in direct conflict with each other for different reasons, and that exploration you can expect to embark on with your therapist. For example, it's very common for people to have little kid parts that want to load up on candy at the grocery store, or they want trick cereal with chocolate milk, or and for other parts, whether it's the adult main person that's not in alignment with them trying to eat healthier and watch their cholesterol or whatever they're trying to do, that's not very helpful. And also there are parts, personalities, that literally do have body dysmorphia or anorexia or bulimia, and they can be very strong, and those parts can literally hijack the whole system because they are so focused on their body or being skinny. And of course we know with anorexia it's never enough, and it's very triggering right now for so many people, whether you have DID or not. All the shots and the drugs and you can be skinny like that. So just please know you're not alone in that, and as best you can to resist on your own thinking that that's an answer, to talk to a doctor, a medical professional. Everyone's got their own path on that, but my point here is the expectation, working with your mental health therapist, that you can understand more of where each of the personalities are coming from, and to try to work together better so as not to sabotage the whole system. And then the third point that I'm making today about what you could expect from therapy is the importance of having support. So I often use the analogy, we need more than one egg in our basket, and a therapist cannot be the only egg in your basket, especially when it comes to DID and feeling so isolated, so alone. Obviously on my platform, there's some conversations going on, and for the most part, it's very positive and just sharing, and no one's being hypercritical about what anybody else is experiencing, which I appreciate. Please, let's keep it that way. So sometimes there are online platforms that can help feel a little more supported. I have another video about choosing the safe people that you might in your life share more about. Yeah, I tend to dissociate. Like, you may notice I forget things, or you may notice that all of a sudden I sound more playful. Actually, that's a thing with me. But again, it's got to be a very safe person. But thinking about that and exploring that with your therapist is very reasonable expectation. How can I gain more eggs in my basket, per se? So the expectation that therapy is gonna fix me is not realistic, or that all of this, the different personalities are gonna go away, that is not realistic either. And I know many people wouldn't want that at all. Like, this is like an internal family. These are my people. And so you could work on that with your therapist too. That I want to feel more like this is a family working together, as opposed to very, very separate or even at odds with each other. That is something that you could expect from therapy. So this is just the beginning of a conversation, I'm sure. But if you have any more ideas, let me know in the comments, and I hope you have a wonderful day. Oh, you're so sweet. Good girl. Wee, good girl.